Necessary components of the FMS Duo Plus system include the Duo pump, a power cord, a 4-way foot pedal. If the surgeon is using another company's shaver system, they can use a 2-way foot pedal, a shaver handpiece with connection cord, an optional FMS waste collection bag, inflow and outflow tubing. If your surgeon uses another shaver system, they can use an FMS shaver interface cable to use their own shaver. Attach the multi-pin connector from the foot pedal to the back of the pump. Attach the power cord to the back of the pump. Turn the main power button on the back of the pump. Then turn the power button standby on the front of the pump. You will hear a short beep. The words pump and shaver will appear in the front screens. You will also see a green LED light blinking next to the run stop button. Connect the FMS Tornado shaver to the front of the pump. Be sure to line up the red dots. If you're using another company shaver, first attach the multi-pin connector to the back of the pump. Then attach the interface adapter to the shaver console where you normally would connect your shaver. You may now connect your shaver to the interface adapter. Have the circulating nurse open the green package labeled irrigation tubing and slowly unwind the tubing. Be sure to close all 3 clamps. With the green semicircle connector facing up, slide the connector into the sliding notch near the left irrigation pump. Notice the arrows on the tubing pointing up, facing you. Center the tubing around the wheel, use a little tension, and close the tension rocker and locking arm. Place the pressure chamber into the holder. There is a groove near one end of the chamber. Slide it into the holder and make sure it remains vertical during the procedure. Unscrew the cap to the transducer. Next, screw the transducer into the plug below the fill chamber button. Turn it slightly left before turning clockwise. Make sure it's tightly screwed in. Close the cover and make sure it's flush against the pump. It's important to ensure the cover is touching the pump at all times. The pump will temporarily stop working if it isn't closed properly. Remove the tip covers from the ends of the tubing and spike your saline bags. Unclamp the white clamps under the saline bags. Press the Run Stop button. The LED will stop blinking. Press the fill chamber to fill the pressure chamber with fluid. Push once, wait a second. Wait for the water to enter the chamber. Repeat approximately 3 times until the chamber is about 1/3 full. Do not push the button 3 times in a row. Have the sterile nurse open the orange package labeled Sterile Zone Kit with check valve. Unpack and separate the intermediary tubing and the outflow tubing. Make sure the white and blue connection on the check valve of the intermediary tubing is tight before passing off to circulating nurse. Remove the blue caps on the far end of the check valve and the irrigation tubing below the pressure chamber. Immediately connect the irrigation tubing luer lock to the intermediary tubing luer lock. Open the clamp under the pressure chamber. Find the white piece of tape holding together the outflow tubing. Hold upright and let the waste tube fall. Have the sterile scrub tech pass the end labeled waste to the circulating nurse and insert into the waste collection bag. Remove the white tape and find the orange connector on the suction tubing. With the semicircle facing up, place it into the sliding notch located near the suction pump. Notice the arrows on the tubing are pointing up facing you. Place and center tubing around the roller pump, pulling on tubing slightly, and close tension rocker and locking arm. Starting with the outflow tube, the tube closest to the outside of the pump, slide it snugly into the pinch valve slot. Press the pinch valve button and slide the other tube into this slot. Make sure both tubes are placed behind the holder under the pinch valve. Close the cover and make sure it's flush against the pump. It is important to ensure the cover is touching the pump at all times. The pump will temporarily stop working if it isn't flush. Look for the open end of the intermediary tubing labeled inflow. Connect the red lure lock to the scope sheath. Open the white clamp. The FMS Duo system requires a scope sheath with an inside diameter of at least 5.8 millimeters. Ask your DePuy Mitek rep to confirm this is the case before surgery. On one end of the suction tubing, there are the words labeled outflow cannula. Place this end into the outflow cannula. Make sure the red clamp is open. The other end of the suction tubing says shaver. Insert shaver tubing into the shaver suction port. Make sure the suction toggle is open at all times. Open the stopcock on the scope cannula in the sterile field when you're ready for surgery. Close the clamp under the pressure chamber. If you want to empty excess fluid and debris from your patient's joint, press on the blue cannula suction foot pedal. Disconnect the blue lure lock under the check valve of the intermediary tubing. If other surgeons are scheduled for cases the same day, leave the check valve attached to the irrigation tubing. To use existing tubing for the next case, make sure the irrigation tubing has been left in place at the end of the previous case. Open the orange tubing package and separate the tubing in the sterile field. Make sure the new lure lock is tight on the new check valve. Remove the old check valve. Immediately connect the blue lure lock from the new intermediary tubing to the blue lure lock on the irrigation tubing below the pressure chamber. Open the white clamp under the pressure chamber and set up this suction tubing as previously described. Set the pump to 50 for a shoulder case. Read your quick manual for recommended settings for all other cases. Cannula suction should be set to medium. Shaver suction should be set to low. Set your shaver controls as desired.